it's interesting. Speaking of lips, the other trend I've seen a lot this summer is the permanent lip implant, because people are tired of getting frequent injections into their lips. And I've just been doing a lot of them. I used to use one that was a saline-filled implant, which I liked because I thought it felt very natural. I also liked it because it could be removed in case people wanted to change the size or if people didn't like it. There's another implant that's just come out that I've been using that I really like. It's made by Surgisil. It's called the Permalip.
Surgisil.
And
it's something else I've seen. Okay.
I don't know, you may have seen it at home.
Doctor,
It's like it's a silicone implant, and it looks like a gummy worm. It can also be removed, which I really like, because the old permanent lip implants would get stuck in the lip, and it's horrible. I had to take some out, you know, that were placed 10 or 15 years ago by other doctors.
Scar tissue.
Yes, it's really.
That's painful.
It's painful and it's very disfiguring.
Yeah.
But this new one, I really like very much. It only takes half an hour to put in, and it's done in the office, just under local anesthesia,
of course.
And it's permanent, and that's why people like it, because that's it. Okay. That's fine.
My lips are going down. Okay.
Because then they don't have to come back for frequent injections. And like I said, it's a very simple procedure.
So what's the downtime like? I mean, say you do it on a Friday.
You get a pretty significant swelling for a week. You get more swelling with that than you do with the filler.
Well, you have a foreign body in your lip.
And your body, you know, encapsulates it, and it's just like a breast implant. It turns out to be soft.
Can it get hard like a contraction? No. Okay.
That's very sort of unique to breast for some reason.
Okay.
And people who've had cold sores, they can get a resurgence of those by this. So I always put them on Valtrex or some sort of medicine to help prevent that from happening. The side effects are very few. There's sometimes you can get a little mucus cyst that forms.
It's nasty.
No, it's like a bump inside your mouth. And it either goes away with a shot or steroids, or I can sometimes lance it and it doesn't come back. But everybody I've done.
That's just a reaction to the new implant?
Yeah, it's just a reaction to the manipulation of the lip. Everybody I've done has really, really liked it. And actually I have to upload a couple more pictures on my website.
Stick one in Jerry. I want to see what it looks like.
Okay.
We love Jerry.
The website, by the way, is DanielRonelMD.com, and I have a lot of before and after pictures. It's done by Studio X, which is a really very good web designer. They're right here in Santa Fe. We're going to actually invite them on and to talk about the relationship between the internet and plastic surgery. It's a very interesting relationship. I get so many of my patients that find me on the internet and ask me questions, and it raises a whole lot of issues.
And you also get non-patients. You get people who are considering you, or people who are just curious.
Or just somebody in Alaska who wants to know what to do.
Say something about Facebook.
Okay.
Daniel's been having this argument with himself.
Yeah, I had a page on Facebook, and
you had a personal page for our lives.
And then I started to put a practice page on it, and then I just took myself off of it because I'm getting a lot of patients who want to be...
But you're not explaining it. He had a personal page for himself and our lives, and then naturally his patients would look him up or whatever, business associates, and then want to request his friendship. And he felt bad because, you know, this is our lives. And so he didn't want to invite everybody under the sun into our private world. So he wasn't, you know, he was ignoring the requests, but feeling bad doing so. So then he started his own little page of his practice, but that's a whole entity unto itself.
And the problem is that when people talk about what they've had done, there might be a violation of their privacy, and I don't want to get to that. So I've taken myself off Facebook for now.
But no offense to anybody. He appreciated all the friend requests, and you know. All right, we'll be right back.
We'll be right back. You're listening to Talk 1260 KTRC Western Medicine. We'll be right back.